This critical appraisal is on the diagnostic value of clinical tests for degenerative rotator cuff disease in medical practice. So the search strategy was just from the slides from the MSK slides by the author and year. The objective of this study was to assess the diagnostic value of clinical tests for degenerative rotator cuff disease in medical practice. They used 44 patients, and the mean age was 59, with patients with shoulder pain, duration at least a month, and the diagnosis of degenerative rotator cuff disease. They used a bunch of special tests for all the different tendons of your rotator cuff as the eye. For the C, ultrasound was the reference method for diagnosis and the classification of the rotator cuff tendon abnormalities, and that was done by a trained radiologist. And then for the O, 5 of the 11 clinical shoulder tests demonstrated meaningful diagnostic accuracy when compared with ultrasound. So the study design was a level evidence 2 and was a cross-sectional diagnostic accuracy study. So a little bit more about the patients. They had 44. 6 patients refused to participate. 3 additional patients were excluded because of previous surgery, adhesive capsulitis, and one did not undergo ultrasound, so they didn't have any imaging to compare it to. So finally included 35 patients of the mean age of 59. The inclusion was over 40 years old with shoulder pain lasting at least a month and degenerative rotator cuff disease. Exclusion criteria was patients with limited passive range of motion, tendon calcifications on radiographs, previous surgeries, basically a lot of other shoulder and humeral issues and fractures. Another exclusion was a local steroid injection in the last 30 days, evidence of neurological disease, and then not undergoing an ultrasound and not signing the written consent. For the methods of it, it was collected for all patients that were in the inclusion criteria. They collected which was their dominant side, pain duration, any trauma, triggering symptoms, their level of pain, their disability using the DASH, and then results of the rotator cuff test from the ultrasound. A physician trained in shoulder disease performed the examination for all of the patients, and he was blinded to the ultrasound results. And then the ultrasound radiologist was trained in musculoskeletal disease and ultrasound and was also blinded to the physical examination when he performed the ultrasound. So this is the results of all of the clinical tests on the left-hand side, and then their sensitivity, specificity, positive and negative predictive values, and positive and negative likelihood ratio when compared to ultrasound. And then this is the diagnostic accuracy slide. So the study on the top is the one for this presentation, and then these are some other ones that are testing for subacromial impingement, which is what the MSK study is using it for. So the results, 9 patients had negative clinical testing, but then 3 of them had ultrasound rotator cuff lesions, and then 14 had normal ultrasounds, but half of them had positive clinical testings, and then resisted lateral rotation with weakness as a clinical response was specific and was the only test that results in reaching thresholds of clinical relevance for full thickness infraspinatus tendon tears. The belly off and belly press, or the lift off and belly press, so your Gerber lift off and belly press tests, both seem suitable for diagnosing full thickness tears of subscapularis tears. And then 5 of the 11 clinical shoulder tests demonstrated meaningful diagnostic accuracy when compared with ultrasound, and those are listed below. This was the QUADS for it, is 9 out of 14. And then the take-home points, these tests are good to use to narrow your differential diagnosis before imaging, but because of the inconsistencies when you have 9 negative, but 3 of them had rotator cuff lesions, and same thing with the 14 normal ultrasounds, but half of them had positive clinical testing. It just shows that it is good to kind of guide you in your decision making, but it's not an end-all be-all, and your gold standard is ultrasound. And then here are references.